Hi, doctors. Today we are going to explain the station of pediatric overdose. Now I'm going to share with you my PDF. Okay, so this is one of the stations which comes with the task of risk assessment with history taking. I highly recommend that you practice this station with the group of stations which come with the same task. And this is my PDF. If you are interested in this PDF, you can find it on my site www.casttutorials.com. And also, if you are interested in personal coaching, you can also arrange this. We can also arrange this on my site. If you like the YouTube clip, please hit the like and subscribe. It will be very helpful and motivating also. So let's go through how we can tackle this station. Now, the pediatric overdose is simply you are going to meet a small girl in the pediatric medical ward. Pay attention for this setting, the pediatric medical ward. She has taken 30 tablets of paracetamol 2 days ago. And why are you talking with her? Because the nursing staff informed you that she has been holding a piece of paper in which there is written, they are coming. And also she is not happy or she's afraid going back home. And the task simply evaluate seriousness of overdose, look for the presence of mental illness, history of self-harm, symptom for this. All this can be summarized in risk assessment and history taking. So the task is history assessment and risk taking. Risk assessment and history taking. So, and what is written in the role player's note, which is not mentioned in your in the candidate notes, is that this girl planned to attempt suicide 4 days ago. So she has been gathering the tablets for 2 days, and 2 days ago she decided to take the tablets and attempt suicide. So there has been planning. How did she come to the hospital? Her girlfriend, her close friend, talked with her, and she found her in a very sick condition, and she called the ambulance. So this is the suicidal attempt. The mental state of the patient, you will find her very sad and miserable. She is afraid of going back home because she believes that the aliens are trying to attack her and she is impregnated by the aliens. She also believes that the aliens are planning to do this for everyone and they are want to take over the human race. She is hearing voices of aliens which makes obscene comments, and also the aliens are the cause for her to take the tablets because they have ordered her to do so. Regarding her social life, she is living with her mother and her stepfather. However, her mother is suffering from depression, and she has been admitted to the hospital 1 month ago. Now, regarding our plan, as I say always, because you only have 7 minutes, so you must have good time management, and also you must have a plan in which there are some important points to be covered in 7 minutes. Don't go through the task haphazardly like this. I don't think that anyone can pass like this. So regarding our task in this, our plan in this task, first you must cover the introduction, which is a very important point, the assessment of the event, the ABC assessment, then the symptoms of the syndrome, then the comorbidity, the impact, coping, and the risk, past history, family history, and finally delivering the diagnosis. These are the 7 points which you should cover in the 7 minutes. The good thing about the risk assessment with history taking or history taking alone is that the 7 points, only the variation you will find is in the first 3 points, the introduction, the ABC of the event, and the symptom of the syndrome. As for the comorbidity, the impact, coping, and the risk of the past history and family history, they are typical questions which you can use in all the stations. And this is something which makes this type of task to some extent easy. Again, doctors, I highlight that the task is not only a technical assessment of any of the tasks which you are going to have. You must show your communication skills, and one of the most important communication skills is the empathy, something called the appropriate reciprocal emotional interaction. You must show the appropriate emotional interaction with a girl who has attempted suicide, particularly when she delivers a piece of paper to you to read the main thing which is annoying her, which is the aliens which are trying to hurt her. So pay attention to the empathy and try to practice it. As for the assessment of the risk incidence, which is the ABC technique, I'm not going to go through the details of this technique for the sake of the duration of the clip. However, you can find it in details in my YouTube channel, Risk Assessment with History Taking Task. You can find how to do this technique in details. But in short, you are going to assess the incidents, what happens after the incidents, and what happened before the incident. This is the ABC, and under each heading, you are going to gather the factual information and the mental state. As for the steps which we are going to take, number one, which I highlight again, which I feel that the candidates are not paying attention to, is your introduction. It is very important to pay attention to this simple communication skill. How do you introduce yourself? Because if you don't know how to introduce yourself, don't blame anyone but yourself if you don't pass the membership examination. Because no one will expect that someone who wants to be a member of the Royal College and he doesn't know how to introduce himself, he mess up the patient's name. He doesn't know how to address himself, and he doesn't explain to the patient properly why he is talking with him. It is a very simple thing, and if you don't do it correctly, definitely this will give a very bad impression about you. So simply you will greet the patient, hello, Ms. X. I will, and then identify yourself. I am Dr. X from the mental health unit, and finally explain to her that the medical team is worried about her because there has been an unfortunate event, and you would like to discuss this with her. Then there are two ways by which you approach the station. The way which the approach which I prefer, that I start by gathering important personal information about her, because this will help me to show that I'm professional and also empathetic, and also will help me to tackle any of the tricks of the Royal College, which they usually put in the social part of the patients, because this is usually a blind area for the candidates. And also will help me to cover an important part of the task, which is the history, the social history of the patient, and also will tackle an important part of the risk assessment, because when you gather this personal information, definitely this will give you an information about the level of risk. So we'll ask her about her family, if there is any support from this family, does she have any siblings, any change in the life circumstances. Ask her about the school, which is very important question in this age group, what grade she is in, any stresses, anyone around her to support in general. This is how you gather the personal information, and you will see later on that this will help you later on to cover the station more rapidly. Now, as regards the ABC of the event, the suicidal event, again, start by asking her that you want to know her part about the story, and ask her about the incidents, how many tablets, what is the name of the medicine, did you leave any tablets? This is a very important question. Nobody who is serious in his suicidal attempt takes some tablets and leaves some tablets. Did you take anything else? It is a very important question. Maybe she took other types of tablets. When did this happen? Who was with you? What was in your mind? This is the mental state. So we have gathered so far the factual information. Now we are going to gather the mental state information. What was in your mind? How were you feeling? Did you take anything which can change the state of your mind, like alcohol or cigarette or hash or anything like this? This is different from the medications which she took to kill herself. Totally different. She can attempt suicide under the effect of hash, but she didn't take the hash to kill herself, but the hash changed her state of mind. If she mentions for you the auditory hallucination, don't leave this important information. Ask one open-ended question, maximum 2 or 3 close-ended questions, then return back by signposting to the thing which you have been assessing, which is the ABC of the event, okay? And then after the incident, ask her about what happened after that. How does she feel about what happened? How does she feel being saved? Any plans to repeat it? What could prevent her from doing this again? This will also give you a very good idea about her intentions about after being saved. And ask her before the incident also some factual information before taking the decision of hurting herself. Were there any stressors at home or school? Did she leave any notes? And did she plan for it? How did you manage to get the tablets? Have you ever tried to hurt yourself before? So this is the assessment of the incident, the ABC technique. Now, regarding the symptoms of the syndrome, simply the symptom of the syndrome is the abnormal mental state, and you start assessing the abnormal mental state from the main problem, which is the auditory hallucination, or the auditory hallucination, which we have been talking about. So we ask about, I would like, saying, start assessing the mental state, saying, I would like to know more about your experience, and ask her, have you have mentioned that the aliens ordered you to take the tablets. Can you tell me more about this? How many voices, etc. Assess the auditory hallucination. But very important to ask her, since when did she start to hear these voices? When did she start to hear these voices? Anything happened at this time? Very important to know the duration of the psychosis, because we know in our nosology that the duration is very important to come up with the appropriate diagnosis. And ask her about the course. Does she feel that the voices are increasing? Anything makes them increase or decrease? Then assess the other psychoses, like any unusual experiences, like seeing the aliens or unusual tastes or smells. Anyone else is trying to hurt her other than the aliens? Does she feel that the aliens are trying to control her mind, putting thoughts or taking thoughts out of her mind, etc.? Then assess her mood. The typical questions of mood: how was your mood in the past 2 weeks? Are you still interested in things which you like to do? Do you have energy like before? Do you feel that? How do you feel about yourself? How about your sleep and appetite? So this is the assessment of the syndrome, which is point number 3. And according to our plan, these are the main 3 points, which are variable from one station with the heading of history or risk assessment, or history with risk assessment. Okay, then the rest of the points are typical question. The point number 4, which is the comorbidity, the good thing that you will find that you don't need to ask about the comorbidity, because it is already have been covered. When we gathered the personal information, you have covered any comorbid social problems. When we assess the mental state, we have covered the comorbid psychological problems, and she has been already medically cleared. So point number 4, there is no place to assess for the comorbidity as a separate entity. It has been spread all over the place because we have asked in details about different aspects of the comorbidity. Now, the point number 5, I always highlight the point number 5 because it is related to the time management. If you hear the bell of 6 minutes and you have not reached point number 5, which is the impact, coping, and risk, immediately leave whatever you are doing and start assessing the impact, coping, and risk, the past history, family history, and delivering the diagnosis. You can hardly cover these 3 points in 1 minute. So if you hear the bell of 6 minutes, please start assessing the impact, coping, and risk. The routine questions: I'm worried about you, but say it with empathy. How did the aliens affect your life? How are you coping? Do you use alcohol or street drugs? We have already asked about the past history of hurting yourself in our assessment of the ABC. So this is enough to assess the impact and coping and risk. Then ask about the past history and family history. Again, these are typical questions. If she has been in contact with psychiatric services before, any family member has been in contact with psychiatric services before. But there is a very important question about the suicide in the past history and family history, if there has been any positive family history of suicide before, because we know that family history is closely related to the suicidal events. Now, finally, delivering the diagnosis, you can add something like you are passing through a psychotic episode, and there are a lot of concerns about your safety. It is not written here because it depends upon your findings. However, you can write down that she is passing through a depression and psychotic episode according to your findings, and say to her that it is better for you to stay in the hospital because there are a lot of concerns about her safety. Finally, doctors, always I recommend that make your preparation effective. use this mark sheet to assess yourself and assess your colleagues. If you want to know more details about how to use this mark sheet, you can find it in the clip of explanation of the erotomania. But always use this mark sheet to assess yourself. And the good thing is that it will decrease your anxiety from the examination, because you understand how you are going to be assessed. And when you enter the station, you know what is the examiner doing and what he is taking, because you have a good idea about this mark sheet. I hope that you found it helpful. If you are interested in this PDF or in personal tutoring, you can arrange for this on my website, www.casctutorials.com. Thank you.